This thing is a common challenge because sometimes you can manage a good phaco, but finally the patient won't be happy because of your prescribed glass. So there are many causes for non-tolerance of the glasses. Could be a error in the refraction, error in the dispensing, communication, or some eye diseases producing, or a patient having some psychological this thing. And if you take an average, at least 6% of the patients are unhappy. Maybe due to different reasons, heavy frames or lenses, near vision correction is either too high or a lower position, frames is not fitting to the patient's eye or its allergic material, fogging of the lenses, eyes pull on wearing new specs can have induced phorias, can have a distorted or tilted images due to incorrect cylinders. It can have pincushion distortion, awkward head positions due to some errors in the cylindrical positioning. Double vision can be there if the placement of the near vision is not that accurate. If you take it in an other way, it can be divided into cosmetic and functional errors. Wrong prescription. Sometimes one person, your refractions will be doing a refraction and she or he is writing in a particular way and you will be copying down in another way. Could be an improper frame or lens or due to the fitting. Overcorrection is usual sometimes because you know that few of the profession requires undercorrection. Like carpenters or priests and all these people. Our refractionist or we will be doing a refraction at the reading distance, but they occurs at a different distance. Inadequate correction. Some cylinders are not given properly, so that sometime we are doing in an auto refractometer in a children. It can happen sometime. Incorrect or illegible prescriptions. You have to be very careful. When you write it 0.25, it should be 0.25, not 2.5. And when you consider about the fitting, you have to consider about the many readings. The frame should fit and to the head of that particular patient. The IPD should be very correct. These are useful, very very useful in the frame selection and lens adaptation. IPD measurement you can do it with the optician's ruler, or you can calculate from the inner canthus of one eye to the outer canthus of the other eye, or from the people. The frames must be comfortable. You can have different options. You can have the patients to wear these glasses, or you can have a computer this thing. I think most of the time when they use the frames and look at the mirrors or whatever you are providing it, they have to be comfortable. Suppose another person is coming and selecting the frame, sometimes you will end up in trouble. Lens should be perpendicular to the visual axis. The bridge size is very important. The person to person, actually the size of the bridge nose will be different, so you have to be very careful in selecting the frames. Tilt of the frames is very important. Sometimes it happens in an upward direction because sometimes we must have given it in a correct way, but after some time the patient will have some bending or something, then it gets tilted in the other way around, then it will end up in problem. Frames should not rest on the cheek. If it is resting on the cheek, definitely the patient will come back with a lot of complaints. You won't understand what they are complaining. So you have to look at the patient whether the frame is hitting or sitting on the cheek. And it should not cover the eyebrow also. Round frame, actually in between, actually it was a people were trying some round frames. You have to be very careful. This frames, this lens will rotate, and if there is a cylindrical power, you will end up in problem. Spectacle frames, whether you require a computer program to select it, it is good for marketing it, but it's not necessary for the frame selection alone. Sizes also you have to be careful. Changes in the frame size can have degenerations, and the sizes of the nose bridges, as I mentioned earlier, should be correct for that particular person. And try to fit the lenses at the anterior focal point should be large enough to give a good visual field. The vertex distance should be very, very accurate. Sometimes the trial frame what you are trying, the vertex distance will be much, much different from the spectacle frame. So that person is going to have a lot of problem. Patient will not see better with the specs over an eye patch. Sometimes this happen in our clinic also. Patient will be wearing one side some patches. They will tell that I am not able to see with the specs and all. So you have to see what is the problem at that particular position. High index glasses for the high refractive errors. This is a must actually. Otherwise patient will have a lot of problem. Anti-reflection coating, I think Dr. Andrews has mentioned you different techniques of that thing, and that will decrease the glare and shop window effects, because some of the patients when they are going outside they will have a lot of problems. When you check the lens power, it will be correct. The patient will go and complain that I am not able to tolerate this glass. The finding the optical center, we earlier had a lot of methods, the cross line and all. I think most of the centers now having auto lensometers. With that thing we can easily find it out. This type of lenses already mentioned, the cryptop, executives, deep bifocal, varifocal and all these lenses, we have to be careful which lens we are prescribing to a particular patient, and we have to counsel the patient, see what are the advantages of that particular lens and what are the disadvantages of the particular lens, and the patient has to select according to his profession and his even financial status. The image jump is an important problem in bifocal. That is by the sudden introduction of the prismatic power at the top of the bifocal segment. It will be less if the optical center of the bifocal segment is close to the top. So that when you look at these lenses, you can see that in a cryptop, actually the optical center is lower, so you can have a more image jump. But flat top will have a minimal jump, and an executive type has almost no jump in this. I'll skip 2 or 3 slides. Okay. Correction of astigmatism is very, very important. With the rule, astigmatism are less symptomatic because they can tolerate vertical distortion, but never try to cheat the axis. So you have to be very accurate in detecting the refraction or detecting the glass as well as dispensing the glass. Children, of course, can tolerate high cylinders, and even you can tolerate a lot of difference in the prescription, and they won't be complaining. But you have to see that they will have some amblyopia developing because of that thing. Anisometropia and anisoconia, the difference of 0.25 is equal to 0.5% difference in the size of the retinal image it will produce. So they can tolerate a maximum of 2.5 to 3 diopters, that is between the eyes. And of course we have experienced that children one eye, even if it is -6 and other eye is without any glass, they will tolerate it. And difference in the base curve of the two lenses, again we have to be very careful. Sometimes you will be changing only one glass of a particular frame, so only one change is in the only one glass. Sometimes they will put it in another base curve, and the patient will come back with a lot of problems. So better to change both the glasses together. So in our responsibility is, do not change any glass if the patient is not symptomatic. Give same base curve as before. Steeper base curve or lash clearance to be avoided, as it will cause image magnification, and higher minus specify high index lenses, and also avoid large frames in high myopes, because the periphery will be very thick and that will have a lot of prismatic effect. And we have to specify anti-glare coating to some professional, and you have to tell them at the beginning, otherwise they will come back later and will blame you for all the prescriptions. So proper counseling is very, very important. It is not just the prescription of the glass. We have to tell them what are all the problems with this particular glass and what the glass type you have to select it and what is the frame you have to select it. And as Dr. Andrews has mentioned earlier, shifting from bifocal to progressive, you have to be very careful. If a 60-year-old person is shifting suddenly from bifocal to progressive is a problem. And again, a monofocal lens to bifocal again is a problem. So this all should be explained to the patient. And finally, some of the patient will come back and tell you, my earlier spectacle was better. You should not produce this type of situation. So ideally, in every patient, after you should tell your refractionist to check it. The final glass prescription, you put it in the trial frame and then remove it, then ask the patient to wear the older glasses and ask the patient whether any change is there. If the patient is telling my older glass is better not to change it. So I will come to the second part of my presentation. This is about computer vision syndrome. It is defined as a complex of eye and vision problems that are experienced during and related to computer use. Actually, this is a repetitive strain disorder. The main question most of the patient ask is, what about the radiation from the computer? Actually, there is not much radiation coming from the computer. Actually, symptoms are due to ocular or a general fatigue, and disability or discomfort endured is blamed as radiation. It is due to some other reasons. What is the basics of print matter and what is the basics of computer screen? The individual pixels are brightest at their center in a video display terminal, and it diminishing its brightness towards the edges. But the print matter is not like that. When a light meter with a very small aperture is passed across a pixel with a light amplitude being charted against the horizontal location, the pixel shows a bell-shaped curve, while the same light amplitude graph of a printed character forms almost a perfect square wave. So printed matter is different from computer screen matter. So in a pixel-based image, the eyes cannot focus and remain on a plane with it. In a printed matter, you can focus and remain in that plane. So in computer use, instead of that thing, the eyes move out to a point called a resting point of accommodation. This resting point of accommodation is further away from the working distance to their computer. Thus, their eyes are constantly moving to the resting point of accommodation and then straining to regain the focus on the screen. So there is always a focusing and defocusing. It produces lot of strain to the ciliary body. So this is an extra problem which produces with the computer screen. So the patient will come with a lot of complaints. They will have a temporary nearsightedness, double vision, dry eye, photophobia, headaches, eye strain, redness, neck and back strain. They will come with a lot of funny different complaints also. So how will you solve these issues? We cannot change the basic things, but we have to find out some measures to reduce the symptoms. We can ask the patient to blink, breathe and break. These are 3 B's tried. You know that every person blinks in every 12 to 15 minutes. And your blinking will be more when you are excited, but it will be reduced when you are concentrating on a particular thing. It is more common with the computer use. Your blinking rate will come down. So if you are particularly instructing the person to increase the blinking rate, it will wet it, it will clean the cornea, and patient will feel more comfortable. Breathing exercises are very, very good. I think most of these computer institutions, they are even trying some yoga and other things, and it increases the oxygenation and it produces relaxation of the muscles. Not only body muscles, can also relax the eye muscles, ciliary body. The breaks, we can have different types of breaks, depends upon his job. We can advise all these things, micro breaks, mini breaks and maxi breaks, and he has to select it and he has to adjust it according to his job. we require special attention for the computer vision, and for that thing we have to have different types of glasses. Actually, this is a very big headache for the ophthalmologist. Sometime one patient with a computer vision problem comes and sits you in the office, you have to take a lot of time to correct it. As already Dr. Andrews has mentioned about the use of anti-glare lenses, these are all the different lenses which is available. But we have to be very careful about selecting the lenses. Most of the time you require the intermediate distance. Intermediate distance, when you calculate it, should be proper and also should be wide, so that a regular progressive lenses won't be working very well. So you have to go for the progressive lens with a central wider zone. Anti-reflective coatings definitely will help the patient, and there are some special lenses which are used wear over the regular lenses. The other question which many of the persons will ask is, I don't have any glass power, my vision is 6:6, whether I require a special lens for the computer use. We can have anti-reflective coatings, but there are people who tries on rimless lenses with plus 0.25 diopters, and this is to reduce the resting point of accommodation, so that the separative movements will be reduced, his ciliary body will be little more relaxed, and some people accept it, not every person, but this is a theory behind giving a 0.25 glass. Then we can have a flip focals. There are different lenses for different powers. I am not going into the details. And you can have the clip-ons on the regular lenses for the top part, where you use it for the distant vision. You can have additional glasses clipped on that thing, so that it can be used for the intermediate distance for computer. Progressive lenses, as I mentioned earlier, you should have an intermediate zone which is wider, that is the soft designs. Alternative glasses actually we can try bifocals with the top additions. We can have increase the size of the monitor and different methods. And computer ergonomics also you have to consider it and be comfortable and a PC. Thank you for your kind attention.